Being a data junkie, we always say our data tells a story, right?
Hi everyone, welcome to Operator Insights. My name is Julie Roberts, and today we are going to talk to Lena Tisten from the Revenue Integrity and CDM Service Line here at Ensemble. Welcome, Lena.
Thank you, Julie.
It's always good to be able to talk about revenue integrity and CDM. I know it's near and dear to my heart. Tell us what Chargemaster is and how that even fits into the revenue cycle.
Absolutely. So Chargemaster is something we often refer to as being the hub of the revenue cycle wheel. We touch every single department in revenue cycle, and not just revenue cycle, but also our clinical areas. Chargemaster is where all of our charges are housed. So from building new procedures, setting up new departments and clinics, everything feeds up through Chargemaster. And one of the biggest things we focus on is obviously making sure we're setting our fees appropriately, and most importantly, keeping up with all of the government regulations and a lot of those hot topics that come up from quarter to quarter or from year to year.
So, Lena, Chargemaster is so critically important, as you mentioned, to healthcare, and it sometimes is an anomaly, right? Folks don't really know what it is. They think of it as a spreadsheet, right? A CDM is a spreadsheet. Can you tell us how you define CDM and really making the impact at the patient level with management of the CDM? Can you tell us a little bit about that?
So I think what makes Chargemaster so unique is that we really want to recruit and hire curious associates. So, Chargemaster is not all black and white. Not every department's built the same way. Not every fee is the same. So we have to have people that work on our team that can think outside of the box and want to do research and go out there and kind of, be a data junkie like I am. Sometimes we do work in spreadsheets when we're doing our analytics and things like that, but it really is all about wanting to know what's going on in healthcare, always keeping in mind that we're impacting our patients each and every day, even though we're not bedside, that we work through these clinical areas, these operational areas, and making sure we're always connecting the dots.
Tell me about, from a EHR perspective, right? Healthcare organizations are on, different systems, Cerner, the Epic, the Meditech, the stars of the world. And how does that impact your CDM folks in the way they manage or what they oversee to ensure best practices?
I think what makes our team so unique, and one of the reasons I'm so proud to have the team we have, is we're not bound to a certain patient accounting platform. We're not bound to a certain billing system. Our team has experience in every patient accounting system out there. So from your Epics to your Cerners to your AS400s, if that scares anybody, our team has been there. We've worked in those environments. So I'd like to say that our impact is minimal with learning curves. We more focus on that particular client, how that client handles their day-to-day operations, what we can do to help create a robust Chargemaster for them. And again, just having so much insight based on how many years in the industry this team has to help support those clients.
That's good. That's good to know. You talk a little bit about the skill set of the folks that we have and how they kind of span multiple platforms, which is great. Super proud of the team. Tell me about, as you continue to build and grow, what types of folks are you looking for that would join the Chargemaster team, right? There's no school to become a Chargemaster leader or analyst level. So what are you looking for aside from the inquisitive nature that you mentioned earlier?
I think from someone looking to get into healthcare or, again, just being curious about revenue cycle, Chargemaster is a great place to start because you do have an impact from the ground up. So learning about government regulations, like I said, just learning how to build a Chargemaster, how to do that research. And if you want to be part of a team that's growing and wanting to be innovative and taking risks, this would be the place for somebody. From someone who is a data junkie like most of us, we have an analytics team that performs CDM assessments and really gets that well-rounded background, as it pertains to, you've seen one CDM when you've seen one CDM. So with our leaders that we want to hire, we want people leaders. We want people that are going to come in, that are going to hit the ground running, that can motivate this team and take us to the next level, which is where we want to be.
If someone knows CDM in their space, maybe in a for-profit or non-for-profit world, and we bring them over here, what is their onboarding and what will their experience be?
So with onboarding, I focus on a few different things. So one is obviously getting connected with those that work in other departments that we impact. I think that's always so critical, is to know what you're doing in your Chargemaster environment, what you're doing within your team, what that domino effect looks like, and you always need to be able to know what resources you can tap into. So first and foremost, that's one thing I focus on, is just building those relationships. Secondly is cross-collaborating with the team. So if we have someone that's come in with a Meditech background solely, or a Cerner background or Epic background, working side by side with others on the team who have that additional background with other platforms, to help grow their knowledge and see outside of maybe that box that they've lived in for so long. The last thing that we focus on is obviously creating best practice, making sure we have solid policies and procedures, and being able to see how that impacts our entire client base. So it's really this nice view that they get by the end of their onboarding process to say, I can focus on any client, I'm ready to take on that challenge, and it helps them create a more in-depth perspective of what CDM may have meant in the past. It really helps give them a more in-depth view of that.
Yeah, I've seen you be able to translate, right? Someone in CDM, typically there's one Chargemaster guru, right, at any healthcare organization, probably been there 10, 15 years, and they've not had a resource, right, to kind of bounce things off of, or have a network, if you will. What tools, advice would you give that person to continue their journey in education, pushing forward in the space of Chargemaster?
I think just personally for me, knowing what resources you have available to you. So I think, again, one of the exciting things about what we do is offering webinars, putting out material. And I relied on that a lot in my personal journey. So you have to know what's out there and tap into people and say, if I want to learn more about OPPS updates, maybe I've always been focused on the acute side, but I'm a little bit curious about the professional side. Learning what you can go out there and get for free, because there's a lot of resources out there. So a lot of my personal experience and my personal experience of my team has been driving through these big communications that we've been able to put out to help support not only our internal customers, but our client space, our clinical departments, and really letting everybody hear the same message and band together and learn about all of what's going on within not just Chargemaster, but the healthcare industry as a whole.
Right, and I think you mentioned a couple of pieces of content that you have done in the past here. Explain what offerings we have made and where you see that going in the future.
Sure. So this was a really exciting year for us. We were able to put out a couple pieces of content that as a team we're very, very proud of. One of those was offering the free webinar, which was a webinar about OPPS updates, went through department impact with status indicator changes, new codes, even deleted codes and how that was going to impact departments. And then also being able to partner with our coding education department.
Right.
That was a great opportunity for us to provide a holistic view of what was going to happen in 2020, but also allowing to view through a 2021 lens of what's to come, to get people prepared for developing steering committees for price transparency, pushing people to go through the testing period with the advanced diagnostic imaging changes going on this year. So that webinar in and of itself was a great piece of material to put out. The second piece was going to every single clinical department that we work with and providing those same presentations to them, a slimmed down version, very laser focused on what their impacts were going to be, and having that one-on-one communication with them was key to not only educating them on how things were going to change, not just from a system standpoint with their orders, or documentation, but also their impact to revenue and usage with deleted codes. So those are just a couple of pieces of material that we put out this year that was brand new for us that we're really excited about.
Yeah, they were great, and I know that a lot of folks were attending the webinars. We had over 500 attendees in various sessions incredible. That we're super proud of. So I think you did a great job with that.
Thank you.
Tell me about data, right? So from a CDM perspective, right, there's lots of data, lots of charges, lots of cost centers, lots of movement and activity. How does data play into the focus of CDM management and oversight?
I think data plays a critical piece for us in a few different ways. So first of all, I talked about our annual updates, quarterly updates, just things that happen throughout the year that we need to stay on top of. So in our analytics and data that we have, being a data junkie, we always say our data tells a story, right? So, the greatest thing, again, about our team is we have clinicians that work on our team, we have coders that work on our team, we have a vast, a breadth of knowledge from just the years of experience in revenue cycles. So we're able to look at those changes with a lot of different lenses. From a CDM assessment standpoint, is one of our biggest focus areas. And again, data, when we're dealing with multiple CDMs for a client, or even just one CDM for a client, being able to look at tracking and trending, if we're changing any charging practices, if we're going from charging procedures separately to soft coding them and charging based on level. We have to be able to make sure that we're not impacting revenue and communicate with the departments right up front the second that we see something happening. If we don't see them charging for bedside procedures, it's critical to be able to see that in our data and always stay on top of those trends.
I think you touched on a couple of things that piqued my interest. One is the level of transparency, right? In your reviews that are performed from a CDM perspective, there are findings, there are things that we find. How do you and your team handle messaging the good, the bad, and the ugly, right? Maybe a clinical department hasn't they've been performing a procedure, but they haven't been charging it. And how do you message that at the C-suite level, all the way to the clinical folks that are doing that work every day?
Right. No, I think it's a great question. Your audience is so critical to how you do message those things. So we're able, again, with our CDM assessments, and when we talk about data, to look at more than 24 data points in a CDM, which is huge. So when we're going to speak or present to a C-suite, we talk a lot about what that gross charge impact is going to be, potential net impact. And when we go to the clinical departments and talk about bedside procedure charging or making recommendations for changing charging practices, our clinical departments, it impacts their workflow. It may take more time for them to document. So we've been there, and I think that that's one of the biggest pieces of our messaging is to say we've all been in healthcare, and we know that this is going to impact you clinically. We know that this is going to impact you operationally, and we can help you work through those, those opportunities, those changes, and really partnering with them and letting them see us as a liaison.
I agree that change management side of the work that's being done is so critically important, and to message that is even more important. So thank you for that. I do wonder, you brought up a minute ago about price transparency, and of all the hot topics that occurred in 2019 was the executive order that President Trump put out. And I know there's been some discussion about what does price transparency mean and how is that going to look. So can you talk about the readiness and work that is being done in preparedness of 2021 when the regulation comes out?
Sure. So I think for us, developing that a work group that we had at the end of last year to start talking through some of those regulations and how to start preparing for 2021. One of the questions that we asked in the webinar was, did you wait for the final rule to come out before you started preparing? And overwhelmingly, the majority of people said yes.
Right.
So for us to take a step back and say, from the time that this order is signed, it's always an option for them to say, nope, we're going to go on January 1st, and we need to be ready for that.
Correct.
So now that we have this year grace period, that committee is kicking back off to have discussions on the 300 shoppable services. How do we partner with managed care departments on contracted rates? How do we get everything in one file in a machine readable and make it patient friendly at the same time? And making sure that the websites where this information is going can be accessed by a patient instead of digging through the website. So I think it's all about making sure that you're preparing now. You'd rather have more time than not have enough time and scramble around at the end. And we're in a position to help all of our clients work through that together again as a team. So, with us being prepared internally at Ensemble is only going to help us prepare our clients more for 2021.
Absolutely. And when I hear you say 2021, it's like that, it's not really that far away, right?
No.
So the preparedness has to start now. In looking forward to 2021 and beyond, what is your focus area? Where are you taking the CDM service line? What are you guys focused on to be ready?
Our team is focused on a few different things. First of all, we are heavily focused on automation. So we're working on creating tools to help us turn around assessments faster. The faster we can get the data, the more we can dig in and really focus on expanding, those 24 data points. The other thing that we focus on a lot is just developing really strong best practice within our team. So we have a robust set of policies and procedures, but really continuing to think outside the box and have stretch goals. The sky is the limit for what this team can do and how we can support our clients currently and future clients. And just being able to be at the ready and at the realm to take on those challenges is something that we're focusing on. And then last but not least is, again, content management and communication. We did great things for in our preparation for 2020. That will only continue to improve. So looking at what we can do quarterly, looking at how we put out different pieces of thought leadership as we go along the way, some FAQ documents. It's all about being able to communicate amongst revenue cycle, not forget about our clinical departments, and also bring HB and our hospital side and our professional side together so we can work together on what's to come in the future.
Great. Thank you, Lena, for joining us today.
It was a pleasure.
And be on the lookout for more operator insights.